Y'all, Rickey about the morning show. The timer now is 14 before the top of the hour, y'all. And there's an ad out that said Black Americans face alarming rates of coronavirus infection in some states. Dr. MJ Collier, good morning.
Good morning, Rickey Smiley. Good morning, all of Rickey Smiley Morning Show listeners. We have your coronavirus COVID-19 update for today. There are confirmed cases of 400,000. There are recovered individuals, 21,000, and almost 13,000 deaths. Almost half of the death rates in the United States coming out of the city of New York. Now, you know, Rickey, initially I had to address the internet and social media misinformation that African Americans or black people couldn't catch the COVID virus, that we had some innate immunity and it wasn't going to affect our community. Now we're seeing that it's disproportionately affecting, infecting, and killing black people. In Louisiana, 70% of the people who have had this are dying or that are black, and only a third of the population in Louisiana is black. So we have a death rate that's more than twice our representation in the patient population in Louisiana. And, you know, they already have talked about how during the Mardi Gras celebration, that is when Louisiana became a hot spot.
Right.
Across the country, African Americans who test positive for the virus outnumber Caucasians 2-1. 2-1. In the city of Chicago, where we have a friends, family, and a strong connection, less than 1/3 of the patient population is African American, but 72% of the virus-linked deaths are in the African American community. So the virus doesn't discriminate. Rather, we're seeing racial disparities in who is getting sick and dying, and this is showing and reflecting medical inequalities in the healthcare system. Dr. David Satcher at the Satcher Institute here in Atlanta has talked about disparities in healthcare for the last 10 to 15 years. And now I'm saying disparities. I'm not talking about discrimination. We're just talking about the reality of the healthcare that African Americans get and how they're perceived versus Caucasian or any other patient population when they go to the doctor. Now, why is that? Why are African Americans being disproportionately affected? One, we still don't have a lot of African Americans that are on board with the social distancing, and they're not staying home. They're still doing a lot of their usual and customary activities, and oftentimes that's brought about by their job situation. A lot of African Americans don't have jobs that they can do from home. They can't get on a computer and perform their work duties and still get paid for it. You know, most of the service professions are dominated by African Americans. So that's why you're seeing it in your bus drivers and in your subway drivers and a lot of people in the service profession that are coming down with this. So it's a true reflection of where we are in the society. But I know that I have had patients that have had symptoms that happen to be African Americans that have presented to the hospital emergency room and not been tested. I think I told you that I had one patient whose husband is now in ICU. Sent her down to the hospital in Atlanta, the big hospital, Emory Hospital. They refused to test her because they said she didn't have symptoms. Now, if you have a husband that you've been living with and he's in ICU, I think that's a close enough exposure that you might warrant testing. But they didn't test her. She had to come to my office to be tested, and we're hoping that her situation, works out fine for her. But, this is just showing where things are. But when you go to the hospital, if you're sick enough and there's testing available, don't let them not test you. You have to, be your own advocate. You have to request testing so that you'll know how to be treated. Then, even if you aren't tested, you demand treatment. Give me something for my symptoms. I need a decongestant for my chest congestion. I need an anti-inflammatory for my muscle ache and fever. I need, an antihistamine for my nasal congestion, etc. Treat me as if you would any other emergency room patient that's coming in to be treated, and not just dismiss me and say, go home for 14 days, which is what we're seeing in the African American population. And Rickey, I had 2 cases yesterday of individuals that had been to the emergency room. One had been tested. They tested negative, but they ultimately tested positive, and now they are in the hospital. And that's one of the other things about testing I shared with the audience. that the testing is only as good as the day that you get the test. You may not have the test if you're positive. If you test negative, it may mean that you don't have it. It also could mean that you're early in the process and you don't have enough of the virus or a large enough viral load so that your test will be positive. So getting tested again if your symptoms progress is not inappropriate to do so. So don't say, well, I went to the hospital and I tested negative, so I'm going to be all right, or I guess I'll be all right. This is not the time for guess, because if it hits you hard, the progression of the disease is rapid and you go downhill very, very fast. So you have a small window to implement treatment, and that's how we're going to go. I was pleasantly surprised to see yesterday on CNN, Chris Cuomo, who had talked about, he didn't think any supplements would work. Yesterday, he said, they asked him, what are you doing to help yourself get better? He said, well, I'm taking my vitamin D. I taken my vitamin D and I went out to get some sunlight so that the vitamin D could be activated. And I've been told that vitamin D helps with the virus and progression of the disease. So he must be listening to the Rickey Smiley Morning Show. So because we've been talking about that now for weeks. But we're telling people the things that you need to do. You need to, there's supplements that will help. You've heard us talk about them: vitamin D, omega-3 fish oil, probiotics.
Hey, Dr. Collier.
Yes,
I want
sir.
you to stop right there at vitamin D. I want you to break down that vitamin D, 5,000 milligrams. That's what you personally prescribe for me on the other side. Dr. MJ Collier is about to break down the vitamin D, the probiotic, and the omega krill oil pill, or whatever they call it. Up next, Rick's about the Morning Show.